All right, prior to proceeding with the video, I would like to ask for your permission to record and upload this video as unlisted for my instructor to view and grade. Do I have your consent?
Yes.
Awesome. My name is Renika and I'll be performing an abdominal exam on you today. I have gone ahead and washed my hands and put on gloves. I'm gonna have you lay back down with your arms to the side. I'm gonna put this pillow under your knee. This position is just important because it helps make sure that the abdominal muscles are nice and relaxed. Are you in a comfortable position?
Yes.
Perfect. So we're gonna start off by inspecting her abdomen. Gina, if you could go ahead and lift your shirt up for me. Perfect. During inspection, we want to look at the shape and the contour of the abdomen. So when I look at her abdomen, it is flat, it's symmetrical, there's no visible bulges. And I can see a gentle peristaltic wave, which is awesome. I'm gonna go ahead and assess her sclera color. So I'm gonna go ahead and have a look. Perfect. And her sclera is white, which is what we're looking for. If it was yellow, then we would know that she may have possible jaundice. And then while assessing the skin, I'm also looking for any scars. So there's no scars, there's no discoloration. The color of her abdomen is appropriate to her race. There's no stretch marks, no lesions, no bruises. There's no dilated veins. And then when I go ahead and touch, her skin is warm and dry to the touch, which is perfect. Next, we're gonna auscultate. So I'm going to go ahead and listen to the four quadrants of her abdomen with my stethoscope. I'm gonna start at the lower right quadrant and work in a clockwise motion. And then it's normal to hear about 5 to 30 sounds within a minute. And these sounds usually consist of gurgles and clicks. So I'm gonna go ahead and auscultate her bowel sounds. Awesome, then I'm gonna move up to the right upper quadrant. And then to the left upper quadrant. And then the left lower quadrant. Awesome, so bowel sounds were present in all four quadrants and they were normal active. Next, we're gonna go ahead and listen to her aorta, which is about 2 inches above the umbilicus. So we're going to locate the umbilicus, go 2 inches above. I am going to auscultate with both the diaphragm and the bell of the stethoscope. So we're going to be listening for any vascular changes. I'm going to go ahead and listen with the diaphragm first. And then with the bell. Perfect. And I'm just going to move directly to the right for the right renal artery. So we're going to listen with the diaphragm first. And then with the bell. And then we're going to move slightly left to the aorta for the left renal artery. And then we're going to listen with the diaphragm. And then we're going to listen with the bell. Awesome, and then we're gonna move lower to the iliac arteries. They're right near the iliac crest, so we're gonna listen bilaterally with the bell and the diaphragm once again. So we're gonna go from this side. And then the right side with the diaphragm first. And then the bell. And then lastly, we're gonna listen to the femoral arteries. Normally you would assess this without the patient's clothes on, directly on the skin, but for this video purpose, we will be auscultating over the clothes. So we're gonna go right to the femoral artery right here. And then with the bell. And then on the right hand side. Awesome. So there was no bruit or friction rub noted in any of the arteries, so that's perfect. Next, we're going to move on to percussing. I'm going to take the middle finger in my dominant hand, and then I'm just going to quickly strike it with my non-dominant hand to percuss. I'm listening for either tympany or dullness. Usually the abdomen is mostly tympany. If we hear dullness, then that would indicate an organ, fluid, or feces present. So I'm going to go ahead And start down here, and then we're gonna percuss for our abdomen. So mostly tympanic, and up here, if we get up here, we feel the dullness, which is her liver. All right. And then now we're going to locate her liver by percussing. So I'm going to start right below her breast kind of, and then percuss for dullness until it stops to kind of measure her liver. So we're going to start right up here, Gina. Stop. So we can kind of see this is how big her liver is if we were to measure it with a ruler to get the exact size. And then we're going to also percuss for her spleen, which is going to be on the left-hand side, and we're also looking for a dullness sound. So I'm going to go ahead over here. Awesome. And then lastly, we're going to percuss for the bladder, which is right under the umbilicus. We're going to percuss in like a downward movement. It should be mostly tympanic. If we hear dullness, it just means that there's some urine in the bladder. So I'm going to start right over here. Oh, it's kind of dull. Awesome. So after percussion, we're going to go into palpation. We're going to start off with a light palpation, which is about 1 centimeter in depth. So I'm just going to kind of use the pad of my fingers to feel, starting from the right lower quadrant, again, moving in a clockwise motion. Just feeling for any tenderness, any guarding from the patient, or any superficial organs or masses, anything like that. So we're just going to do a light palpation at first. A little, just kind of, any tenderness, Gina?
No.
Awesome. And move in a clockwise motion. Any tenderness on this side? Perfect. So after we do our light palpation, we're going to do a deeper palpation. So we're just going to kind of go a little deeper in to see, again, if there's any tenderness, abnormal masses, anything like that. So we're going to do a deep palpation, Gina. Here we go. Any tenderness? No? Perfect. Any tenderness over here? Okay, got it. All right. So she didn't have any tenderness in those areas. We're going to deep palpate for the liver as well. So we're gonna kind of go into here and feel for it. Right there. Awesome. We're gonna also palpate for the spleen, which is gonna be on this side. And I am unable to palpate for the spleen, which is good. That means it is not enlarged. We don't want to be able to feel it. Awesome. And then we're going to go ahead and just perform a couple of tests for the abdomen. I'm going to first check for ascites. So I'll have the patient put her hand in the middle of her stomach. I'm going to put my hands on the sides, and then we're going to apply pressure on one side, then the other. Awesome. And then when we're doing that, we're looking to see if there's a shift in fluids, if her hand moves, or if there's any waves that would indicate ascites. Next, we're going to do the Murphy's test, which is to see for cholecystitis, which is for the gallbladder. So I'm going to press down on the upper quadrant, kind of pressing for that liver. I'm going to ask the patient to take a deep breath, and if the pain is severe or if they kind of stop breathing, then we know that their gallbladder is inflamed. So Gina, I'm going to go ahead and push down here. If you could take a deep breath for me. Awesome. Any pain?
No.
Perfect. So she had no pain, which means that her gallbladder is doing great. Next, we're going to test for appendicitis. So we're going to look for the McBurney's point. Usually you'll identify your umbilicus, and it's about two-thirds down from there. So if you kind of create an imaginary line, be right over here. I'm going to go ahead and gently apply pressure. And then quickly release. Any pain there, Gina? Perfect. So if there would be pain at my release, then we know she has appendicitis, but she's okay. Lastly, we're going to be pressing to see the tenderness of the CVA. So Gina, I'm going to have you sit up for me. Awesome. So I'm going to place my hand along the CVA area, make a fist with my other, and strike on it to see if there's any tenderness. So I'm going to go ahead and lift this and find the area. Put my hand right here. And I'm going to, any tenderness, Gina? Perfect. And we'll do the same thing on the other side. I'm going to put my hand, find the area, make a fist. Any tenderness? Awesome. So that concludes our exam for today. Do you have any questions for me, Gina?
No.
Perfect, thank you.